Hi everyone. So my research is about Treacher-Collins syndrome in orthodontics. My PIs are Dr. Cheever and Dr. Hung. So the introduction, Treacher-Collins syndrome is a condition where there is a congenital malformation of the craniofacial structures, which are derived from the first and second pharyngeal arches during development. And the oral manifestations of this syndrome include underdeveloped jaw, retracted tongue, underdeveloped zygomatic bone, and cleft lip and palate. They generally require a multidisciplinary approach to treatment, which includes speech therapy, language pathology, audiology, general dentistry, orthodontics, oral and maxillofacial surgery, and a lot of reconstructive surgeries to improve their facial appearances. And these surgeries usually start when they are fairly young, like infants. So the aim of this paper was to provide a recent orthodontically focused review that covers the current practices in this population and to find out where future research needs to be done. So my methods included using the PICO population, population being Treacher-Collins syndrome, intervention being orthodontic treatment / facial appearance. There was no comparison, and the outcome being malocclusion. The keywords used on PubMed were Treacher-Collins and orthodont, Treacher-Collins and orthodontic interventions, and craniofacial development. Relevant articles from 2012 to 2021 in English only were used. The inclusion criteria of this study selected were Treacher-Collins syndrome and orthodontic intervention. The results included, so there was no cure for this syndrome, which is why the treatment is mainly symptom-based and requires multidisciplinary care, and it's mainly focused on the functional care. So there were three aspects that I was able to put together so far, which are seen in these patients and what can be done to take care of them. Reduced salivary flow. This is due to the maldeveloped mandible, malocclusion, and crowded dentition. Its treatment is to use a fluoride toothpaste, avoid alcohol containing mouth rinses because it'll make their oral mucosa dry, stimulate salivary flow by sucking on sugarless gums or candies, and use saliva substitute. Dysphagia, this is due to the hypoplastic development of the anatomy of the jaw and their surrounding tissues. Their treatment includes minimizing any risk of aspiration and using feeding tube. Cleft lip and palate, the use of specialized bottles and nipples to feed until obturator can be fabricated, and in early mixed dentition, use removable appliances such as palatal expander to correct crossbites and malocclusion. These are my references, and that's the acknowledgement.